The double doors of Chicago Memorial Hospital's emergency room didn't just open, they shattered the midnight quiet. A detail of 4 United States Marines in full dress blues marched into the chaotic triage center. The whispering staff froze. The arrogant attending physician stepped back, his clipboard slipping from his hand. They weren't looking for a patient. They marched straight past the trauma bays, stopping dead in front of the quietest, most disrespected new ICU nurse on the floor, Stella Caroline. When the commanding officer snapped a crisp, razor-sharp salute to a woman wearing blood-stained scrubs, the entire hospital realized they had absolutely no idea who Stella really was. Stella Caroline was a ghost in a place where people usually screamed to be seen. She had transferred to Chicago Memorial's intensive care unit 3 months ago, arriving with a sparse resume that vaguely mentioned a stint at a VA hospital down in Florida and some generic private nursing contracts. At 29, Stella was strikingly unassuming. She wore her dark blonde hair pulled back into a severely tight bun that never seemed to fray, scrub tops that were always one size too large, and a blank, unreadable expression that infuriated the tight-knit clique of the night shift. In a high-stakes environment like Memorial's ICU, a Level 1 trauma center that saw the worst of the city's gunshot wounds, multi-vehicle pileups, and industrial accidents, nurses survived through trauma bonding. They gossiped in the break room, complained bitterly about the administration, and mocked the residents. Stella did none of that. She clocked in exactly 15 minutes early. She took her patient reports, checked her drips with mechanical precision, and spoke only when it was strictly necessary for patient care. This silence made her a target. "She's weird," Brenda Wallace, the veteran charge nurse, muttered one Tuesday night, loud enough for half the nurses stationed to hear. Brenda was a woman who ruled her unit through intimidation and seniority. I asked her where she got her degree, and she just gave me this dead-eyed stare and said, "Out of state." Who talks like that? I'm telling you, she's hiding something. Probably got fired from her last gig for stealing meds. Dr. Richard Hayes, the lead cardiothoracic attending, snorted as he signed off on a chart. Hayes was a brilliant surgeon, but his god complex was legendary. If you weren't an attending, you were furniture. "She's timid, Brenda, a wallflower. I asked her to prep a central line kit for bed 4 yesterday, and she just stood there looking at me for a second before doing it. No hustle, no initiative, just an order taker. Give her the overflow beds." And so they did. Stella was routinely handed the worst assignments. The heavy lifters, the combative patients, the tragic cases that no one else wanted to touch. Yet anyone paying close attention would have noticed the discrepancies in the timid wallflower narrative. When Arthur Pendleton, a 300-pound patient in florid delirium tremens, ripped his IV out and swung a heavy fist at a security guard, the entire room erupted into a panic. Staff scattered. Stella, however, didn't flinch. She stepped gracefully inside the man's swinging arc, grabbed his wrist with a grip that defied her slight frame, and applied a subtle, localized pressure to a nerve cluster behind his elbow. The massive man buckled instantly, sitting back on the bed long enough for the chemical restraints to be administered. When the adrenaline-pumped staff rushed in, Stella was already retaping a new IV line, her breathing perfectly even. "Lucky catch, Caroline," Hayes had scoffed from the doorway, having missed the actual takedown. "Try not to get in the way next time." "Yes, doctor," Stella replied. Her voice was flat, devoid of sarcasm, anger, or fear. It was a voice that had been stripped of emotion. Behind her locker door, taped to the inside metal panel where no one else could see, was a small, faded photograph. It was a picture of a dust-swept valley, a heavy armored vehicle, and a group of young men in combat gear, laughing. Stella was in the center, her face streaked with dirt, a heavy medical pack slung over her shoulder. Below the photo was a small, folded piece of paper with a name written on it, Corporal Thomas Miller, KIA, Fallujah. Every night before she closed that locker, she touched the name. Then she locked away Stella the combat medic and became Stella the ghost. Memorial Hospital didn't need to know about the sand, the blood, the improvised explosive devices, or the silver medal sitting in a velvet box in her sparse apartment. They didn't need to know she had saved 32 men in a war zone. She had come to Chicago to hide in plain sight, to do her job, and to escape the noise of her past. But hiding in a trauma center is a dangerous game. Eventually, the blood finds you. The night the facade cracked was a freezing Thursday in late November. The roads were slick with black ice, and at 2:14 a.m., the emergency dispatch radio crackled with the kind of code that makes every medical professional's stomach drop. A 15-car pileup on Interstate 90. 2 semi-trucks involved. Mass casualty protocol activated. The ER and ICU merged into a single, frantic triage zone. Brenda was screaming orders, trying to assign beds that didn't exist. Dr. Hayes was barking for massive transfusion protocols, his usually pristine white coat already speckled with red. Stella was assigned to Trauma Bay 3, assisting a first-year resident, Dr. Kevin O'Malley. Kevin was smart, but he was green. He had never seen a human body truly disassembled by physics. Paramedics burst through the doors wheeling a stretcher. The patient was a young man, barely in his 20s. The paramedic, breathless, rattled off the report. John Doe, approximate age 20, extricated from a crushed sedan. Massive crush injury to the lower right quadrant. Blood pressure is dropping fast, 70/40. Heart rate 140. We couldn't get a tourniquet high enough on the leg. The bleeding is coming from the pelvic junction. The gurney hit the brakes and the bloody sheet was pulled back. Kevin took one look at the mangled, pulsing mess of the young man's groin and froze. The femoral artery was compromised, but the damage was so high up that a standard tourniquet was useless. Dark arterial blood was pooling on the floor at a terrifying rate. "Dr. O'Malley," Stella said, her voice cutting through the noise. It wasn't loud, but it possessed an acoustic density, a tone of absolute, unquestionable command that made the young doctor blink. "He is bleeding out. You need to pack the junction." I can't see the bleeder," Kevin stammered, his hands hovering uselessly over the wound, trembling. "We need Hayes. We need surgery." "Surgery is 20 minutes away. He has 2, Stella stated, her eyes locking onto the monitor. The pressure was now 60/30. The patient's skin was the color of wet ash. Dr. Hayes was in the next bay, up to his elbows in a chest tube insertion, shouting over the din. "O'Malley, stop the bleed and get him stabilized." Kevin panicked. He grabbed a handful of standard gauze and pressed it against the top of the wound, but the blood simply pushed it away, soaking through instantly. Stella's eyes narrowed. The ghost vanished. The corpsman woke up. She didn't ask for permission. She shoved Kevin out of the way with a hard shoulder check. "Move!" Before Kevin could protest, Stella grabbed a specialized roll of combat-grade hemostatic gauze from the crash cart, a supply Memorial rarely used, but Stella always ensured was stocked in her bay. She plunged her left hand directly into the slick, tearing tissue of the young man's groin, her fingers blindly navigating the destroyed anatomy until she felt the hot, pulsing jet of the severed femoral artery. She pinned the artery against the pelvic bone with her bare fingers. The arterial spurting instantly slowed. "Give me the gauze," she snapped at a stunned tech. You can't just..." Kevin sputtered. "Gauze, now!" The sheer, predatory intensity in Stella's eyes terrified the tech into obedience. Taking the roll, Stella began to pack the wound. But she didn't just lay it on top. Using a technique born in the dust of foreign wars, she fed the gauze directly into the deep cavity, packing it tightly against her own fingers, applying a brutal, localized pressure that civilian nurses were explicitly trained not to attempt without a surgeon present. She packed it until the cavity was a dense, unyielding rock of gauze, then threw her entire upper body weight onto her hands, pressing down into the man's pelvis. "O'Malley," Stella ordered, her voice eerily calm despite the physical exertion. "Push 2 units of O negative. Wide open. Now." Kevin, snapped out of his shock by her absolute authority, scrambled to hang the blood. Within 90 seconds, the alarm on the monitor shifted its frantic pitch. The blood pressure stabilized. The bleeding had stopped. Just then, Dr. Hayes shoved his way into Trauma Bay 3, wiping blood from his forehead. "O'Malley, what the hell is taking so long?" Hayes stopped dead. He looked at the floor, slick with blood. He looked at the trembling resident. And then he looked at Stella Caroline. She was leaning over the patient, her arms locked straight, hands buried deep in the patient's groin, keeping the life-saving pressure applied. Her face was completely devoid of panic. "What do you think you are doing?" Hayes hissed, his voice dropping to a dangerous, furious register. "Junctional hemorrhage, doctor," Stella reported evenly, not breaking eye contact. "Standard pressure failed. The wound is packed with hemostatic agents. Bleeding is controlled. He is ready for transport to the OR." "I didn't ask for a medical assessment, Caroline," Hayes roared, his ego deeply bruised that a nurse, the quiet, useless nurse, had taken over his trauma bay. "You bypassed protocol. You shoved a resident. You performed an invasive hemostatic maneuver without an attending's direct order. You could have killed him." "He was dying," Stella replied, her voice as cold as the November wind outside. "You are a nurse, Caroline, not a cowboy, not a surgeon." Hayes pointed a trembling finger at her. "As soon as surgery takes over, you are off this floor. Brenda, get her off the schedule. I want her written up for gross insubordination and practicing outside her scope." Brenda Wallace appeared in the doorway, a smug, vindicated smile playing on her lips. "I told you she was trouble, Doctor. I'll get the paperwork." The surgical team arrived, transferring the patient onto the transport bed. As they wheeled the young man away, alive, his pulse steady, Stella stepped back. Her scrubs were soaked. Her hands were stained crimson. She looked at Hayes. She didn't cry. She didn't apologize. She didn't defend herself. She gave him that same unnerving, 1,000-yard stare that had bothered Brenda so much. "I'll be in the locker room," Stella said quietly, stripping off her bloody gloves and dropping them into the biohazard bin. She walked down the hallway, leaving a furious Dr. Hayes and a bewildered intern in her wake. She thought it was over. She thought her attempt at a quiet life in Chicago was done, ruined by her inability to let a young man die. She didn't know that the young man she had just saved, John Doe, wasn't a civilian, and she didn't know that an hour later, the United States military would be coming through the front doors of Memorial Hospital to collect him. The women's locker room was freezing, the fluorescent lights buzzing with a sterile, unforgiving hum. Stella stood over the stainless steel sink, scrubbing her hands with harsh iodine soap. The water running down the drain was a pale, watered-down pink. She scrubbed until her skin was raw, her movements mechanical. The adrenaline dump was fading, leaving behind the familiar, hollow exhaustion she had learned to live with during her deployments to Helmand Province. She looked at herself in the mirror. Her tight bun was finally fraying, strands of dark blonde hair sticking to her damp forehead. Her scrub top was ruined, splashed with the dark, heavy crimson of arterial blood. She opened her locker, her eyes briefly meeting the faded photograph of Corporal Miller, before she reached past it for her civilian clothes. She knew the drill. In the civilian medical world, protocol was God. She had violated it to save a life, and the hospital bureaucracy would crucify her for it to protect their liability. She packed her duffel bag with slow, deliberate precision. Meanwhile, 3 floors up in the surgical observation deck, the narrative surrounding the reckless new nurse was rapidly unraveling. Dr. Robert Sterling, Chicago Memorial's chief of trauma surgery, walked out of operating room 4, pulling off his surgical cap. Sterling was a grizzled 60-year-old veteran of both the First Gulf War and decades of Chicago gang violence. He suffered no fools and had 0 patience for hospital politics. He found Dr. Hayes pacing the hallway, flanked by the nervous young resident, Dr. O'Malley, and the hospital administrator, Gregory Aris. "Robert," Hayes stepped forward, his tone dripping with professional outrage. "I need your sign-off on the incident report. The patient is stable, I assume? We need to expedite the termination of the ICU nurse who managed the triage. She went completely rogue. Gross negligence. Practicing medicine without a license. Utilizing unapproved hemostatic packing." Sterling held up a massive, calloused hand, stopping Hayes dead in his tracks. "The boy is alive," Sterling said, his voice a low, gravelly rumble. "But let's get one thing straight, Richard. Whoever packed that junctional wound didn't commit negligence. They performed a masterclass." Hayes blinked, thrown off balance. "She shoved a resident and jammed her hands into a pelvic crush injury without a surgical field. It was a cowboy move." "It was a combat maneuver," Sterling corrected sharply, his eyes narrowing at his arrogant junior colleague. "That kid's right femoral artery was shredded 2 inches above the inguinal ligament. A standard tourniquet wouldn't have done a damn thing. He had about 90 seconds before he bled out on your shiny ER floor. That packing was so tight, so perfectly anchored against the pelvic bone with quick-clot combat gauze, that I barely had to use a clamp when I got in there." "Who did it?" "Nurse Caroline," O'Malley piped up quietly, looking down at his shoes. She just took over. She knew exactly what she was doing."